let's move on to the next research about effect of virtual reality Metaverse on medical competency during COVID-19 pandemic. Systemic review from Mrs. Nattakan Treesasrisakul.
Good afternoon, the committee and audience. First of all, thank you to the committee for giving me an opportunity to be a part of this conference. Since the emergence of the COVID-19 pandemic have affected our living, such as studying and working for at least 3 years. However, healthcare providers still continue to develop our competency for medical students and clinical staff. They try to search for alternative digital technology in order to improve the quality of care with social distancing and safety. The question is there any alternative tool that could compensate for those limitations? Perhaps technology is the answer. Interestingly, the Metaverse or universal and immersive virtual world, as well as artificial intelligence, virtual reality, or VR, has been well accepted to facilitate the learning in recent years. For this reason, we are interested and curious about whether virtual reality can help us improve medical skills during the COVID-19 crisis. However, the evidence for utilizing VR technology to enhance medical competency remains unclear. Therefore, we conduct a systematic reviews of study on medical students who experienced VR program during the COVID-19 outbreak. As shown in Figure 1, we search for study in several databases such as PubMed, Scientific, and ESCO. 140 articles were included using the keyword virtual reality, application, competency, skill, and medical students, which was published in English from December 2019 to August 2022 following the PRISMA guidelines. Non-randomized control trials were included. The iterator in reliability is substantial agreement when using Cochrane-HEPA methods. After screening, 4 articles met the criteria and were included in our study. 3 studies has low list of bias evaluated by using the Cochrane list of bias tool, as shown in table number 1. The inclusion study were performed in Europe and on the North America continent. All of the participants are medical students and resident practitioners. As shown in this finding, VR stimulation for surgical practitioners are effective, and one study found that VR training improved process quality medical skill in cardiopulmonary resuscitation. However, there is no statistical evidence that the use of virtual brain allows for greater learning retention than the conventional after 7 days. And in conclusion, these systematic reviews reveal the power of VR as a digital education tools for active medical training, which can improve competency, including professional knowledge and skill, during the COVID-19 pandemic. Thank you for your attention.
Thank you so much for the presentation. Is there any question from the judges? Okay, so that's a question from online judges.
Okay, thank you so much for sharing your work. I would like you to share your idea on, I see that finally you have only 4, study left. Why do you decide to use only 4 study, and why didn't you, adjust your inclusion or exclusion criteria to increase the number of the study in this review?
Okay, thank you for your question. First of all, our inclusion criteria was like the study designs we choose from randomized control trial, and we choose the study which performed in during COVID-19, because during COVID-19 we have to got the social distancing, so the artificial intelligence or virtual reality has been involved in the medical teaching like this, and also VR can connect the imagination and theory through vision. It assists students in learning and attaining proficiency in their performance. Students are able to study their weakness in some skill whether they want. So this could be interesting point that we have in our research.
Okay. So any limitation that you can share with us of, just including 4 study?
About the limitation, we think that we should show score because of the keyword. We try to convince just only our keyword. They are only like three or 4 keywords. That is limitation of our study. So in future study, we plan to improve the keyword to explain more the data.
Okay, that's good. But actually, it's all about your question. But thank you so much for your explanation.
So let's move on from the question from on-site judges.
Thank you for your presentation. I just wonder, if you had a chance to do this study again, what could you have done better?
Okay, thank you for your question. So in the future study, we plan to improve our keyword setting, like maybe in another platform. I mean, in another way of the education. Maybe not just only artificial.
Unfortunately, the presentation time is over. But thank you so much for this wonderful research.